Hello everyone! Today we are going to talk about a heat lash. A heat lash or picky heat can form on your skin when sweat gets trapped under the surface. You will notice bumps on your skin that feel itchy or pricky. Cooling, drying or airing out affected skin can help get rid of the lash. Anyone can develop a heat lash, but it's common among infants and children, as well as people who live in humid climates. What is a heat lash? A heat lash, also called a picky heat lash or myelic areas, is an area of your skin that gets irritated from sweat. The rash can be itchy and bothersome, but it's usually harmless. You can typically care for a heat lash at home, and it will be cleared up within a few days. Healthcare providers consider heat lash as a mild form of heat-related illness. It's not as serious as conditions like heat exhaustion or heat stroke. But if you are exerting yourself in hot weather, a heat lash could be an early warning sign to cool down your bodies. A heat lash can make your skin feel like it's burning, itchy, pricky. These sensations are uncomfortable and may make you want to scratch your skin. But listen, that irk. Scratching your skin could cause it to break open, possibly leading to an infection. How about what does heat lash look like? A heat lash is a group of tiny bumps, similar to pimple or blister. Typically, each bump is about 1 to 3 mm wide. The bump often look red or like skin color. On darker skin, the bump may look gray or white. The medical term for heat lash that's called this discolored bump is area rubra. This is the most common form of heat lash. Talking about heat lash cause. Sweat that trapped with your skin causes a heat lash. Normally, sweat glands in your skin make sweat and send it through tiny tubes, sweat duct, until it reaches the surface of your skin. This sweat accesses through opening on your skin pore and then evaporates to help cool your body down. Moreover, blood clots can sometimes form in your sweat ducts. A clot prevents sweat from finishing its journey to your skin surface. Instead, the sweat flows backward in the ducts. This causes inflammation within your skin's outermost layer, epidermis, and or middle layer, dermis. The inflammation results in a lash. How doctors diagnose heat lash? You may not need to seek medical care for heat lash. First, ask you when the lash started, when it located, and what symptoms you have had. Second, review your medical histories and any medications you are taking. Third, take a close look at your skin and with your permission, touch the affected areas. Fourth, talk with you about things that might have caused the lash, like weather, physical activities, or management and treatment. What is the treatment for heat lash? It's usually possible to get rid of a heat lash with home care. First, move to a cooler or air-conditioned area if possible. Second, remove clothing from the affected skin. Third, gently wash your skin in cool water and pat it dry, don't scrub. Fourth, keep the lid uncovered or put on a clean, loose clothing that doesn't rub against your skin. Additionally, tip why picky heat lash heals. First, avoid using cream or other product to clog your pore. Second, limit activity that cause sweating. Thank you for watching and listening. Goodbye.